Hello everyone, how are you doing today? Let's take a look at this ultrasound video and evaluate the findings. Alright, the woman was said to have presented with anemia, no history of endometrial bleeding. In this video, we see that the uterus is anteverted, non-gravid. The first obvious finding is the intrauterine contraceptive device, which has its tip penetrating the posterior myometrium but not extending to the serosa. Okay, the next finding is that we note that the cavity contains a polypoid structure, all right, which is arising from the anterior endometrial lining. And we note here that it has a single feeding vessel. Right. So now that these are the findings, we also know that the anterior myometrium has a dark area which is poorly visualized. Okay. So the questions that now follow are: one, what what is the orientation of the uterus? What can we say about the Doppler findings? Okay, so first of all, the uterus is obviously anteverted. The placement of the IUCD, of course, is obvious and its displacement. Then, concerning the Doppler findings, we see that the intrauterine lesion has a single feeding vessel. Now, a single feeding vessel is commonly what we find with intrauterine polyps. Because the question that follows this is usually, so why do you think that the intrauterine lesion is a polyp and not a fibroid? Okay, so the answer is, or the answers are: one, usually fibroids are solid structures. Usually fibroids are round to oval in shape, and fibroids usually have more than one feeding vessel. In this lesion that we are looking at, we see from the Doppler studies there is one vessel penetrating the myometrium into the cavity and into the lesion. That's the feeding vessel to that lesion. So these are the findings. Another question that follows is what are the next steps? Okay. Second question: what's your diagnosis? We have discussed that. What are the next steps? The next steps would include: one, the removal of the IUCD. Now, how you remove the IUCD depends on how deeply embedded it is. If it's just in the muscle, in the myometrium as it appears to be, in the office, ultrasound guided, or if the rope is still visible, you can remove the IUCD with a forceps. However, if it is deeply embedded, it has reached the serosa or penetrated into nearby tissues, you would need laparoscopy. Another thing that may need to be done could be to do a hysteroscopy or hysterosonogram to further evaluate the intrauterine lesion and probably remove it. And finally, the anemia the patient presented with would need to be corrected. These are my thoughts on this. Thank you.